So today we put out a report called How It All Broke. And if that seems a little bit like a big subject, it kind of is. Here's how it came about in our office. We were writing reports on a number of different things here at the Child, Youth and Seniors Advocate Office that explain why a number of things seem to be breaking down. We are doing a report on the long-term care system and why there are so many seniors stuck in hospitals who should be in long-term care. We've been doing a report on why we've seen an explosion of young people with mental health issues and why we don't have enough psychologists, we don't have enough care for them to get the help they need before they show up in an emergency room in crisis. We were doing a report on why schools suddenly, for some reason, seem to have gone from teaching 80% of kids to read to 50% of kids to read. And we've been doing a report on the child protection system, how we have more kids in care, but we know less about how they're doing, and we're seeing some of the same problems over and over. And as we looked at them, we began thinking maybe this is just isolated cases of departments of health, of education, of social development screwing up, or maybe there's a reason that everything's kind of breaking at once. And when we talk to people, a lot of people have this feeling like, gee, is this all breaking at once? When we have hospital emergency rooms saying, look, please try not to get sick or hurt this weekend because we don't know if we can take anybody. At the same time, we've got child protection systems that are having the same thing go wrong as we said would never happen again 5 years ago. At the same time, we've got 2-year wait lists for family courts, 2 years backlog for early childhood education spots, 2-year backlogs for mental health services, even if they're urgently needed. We've got schools where children with significant behavioral or learning challenges wait years just to get assessed, let alone get a learning plan in place. Why are all of these social structures breaking down at once? And when we looked at it really hard, we realized we were saying the same thing over and over and over again. And that in some ways, the reason why it feels like all the social systems are breaking down at once is because of the way we govern at the center. A lot of the ways that we've pushed social problems off into tomorrow, saying, well, surely it'll all get better. And eventually everything kind of broke at once. So what we wanted to do was take New Brunswickers inside of how government works. Because right at the center of government, there are organizations called the Executive Council Office and Finance and Treasury Board. They control really how all those decisions are made at the center, at all of the big social departments. They're the ones who set the budgets, set the rules, set the procedures, monitor when people can break the rules, monitor when people are going over budget, and most importantly, provide the playing field on which all of these social services have to work. Now, those organizations haven't really changed the way they governed in about 30 years. In fact, about 30 years ago, when there was a fiscal crisis and all provincial governments were saying we need to just hack and slash and we've got to get expenditures under control, the Premier of the day in New Brunswick said something that was quite famous at the time. He said, you know, people first and money second ended when the money ran out. And like a lot of governments across Canada and across North America and even in Europe, New Brunswick began essentially having money first budgets. That we have to, whatever else happens, we've got to set expenditures. So we did things a little bit differently. We started having things where we capped the number of people being trained for different professions based on what we're willing to spend, not worrying about what the future need was. We began saying we've got to reduce expenditures today, and if later they cause social programs, we'll fund those tomorrow. We began doing things like saying we have to have strict rules about when civil servants can spend money in order to control things, but not worry about measuring the results. And we began saying, look, let's just remember when we budget, we have to set a target as to what we're willing to spend, but we can't be all that interested in the impact on results. How did that all work out? Well, it certainly worked to control expenditures, but now we're 30 years later, and now we're having 2-year wait lists for services. We're having schools that don't teach people to read. We're having hospitals that can't take any more sick or injured people. We're having government spend more money on policing because there's a crisis. With social outcomes, our courts are backed up. Maybe these are connected, and maybe one of the reasons we can't seem to solve the problems of 2024 is because we're using the budgeting procedures and the management procedures of 1994. It's a little like trying to get a high school dance excited by playing the Macarena. It might have worked in 1994, but it doesn't work now. You could even ask, could that be any more outdated? Because that, of course, would be a reference to Chandler Bing and Friends. But you wouldn't necessarily know that today because it's 30 years later. So what we're trying to do is take a look at Maybe the things that solved the fiscal crisis of 1994 aren't going to solve the social crisis of 2024. And maybe, just maybe, money first and people second ended when people started dying in hospital wait rooms. Maybe money first and people second ended when a lot of young people can't learn how to read. Maybe money first and people second ended when people couldn't get to see a psychiatrist, or couldn't get to see a psychologist, or couldn't get child protection services, or when we don't know whether or not people are moving from social assistance to work, because we simply don't have the procedure in place to solve our social problems. So How It Broke identifies 5 things that government keeps doing that make social programs break. And what I want to do is give you a little tour of those so that you can understand what we're saying needs to change at the center to give the social departments a fighting chance. Because after all, if we're going to spend $7 billion a year on social programs, maybe we should have some idea whether they're accomplishing anything. And that's what we're going to do in this report.